guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering mental health, psych concepts, okay? These are great questions for ATI, NCLEX, HESI. If you're taking mental health right now, psych, you got a midterm coming up, final. This is what you need to know. Lots of great concepts that I'm covering. If you haven't done so already, guys, please be sure to like and subscribe below. Make sure you press that notification button so that every time a new video is released, you'll be notified. So first question, guys. The nurse is discussing the grieving process with the client. Which stages are included in Kubler-Ross's stages of grief? Rank in the correct order. 1, acceptance. 2, bargaining. 3, denial. 4, anger. 5, depression. So what are those 5 stages of grief and what is the order? So guys, the first one is denial. This can't be happening. This has to be a mistake. Then anger. Why me? I'm such a good person. My sister's an idiot. My sister's a jerk. She's the one this should have happened to. Bargaining. You know, God, if you fix the situation so that I'm not sick anymore, I'll become a saint for the rest of my life. Depression. I can't believe this has happened to me. I don't want to talk to anyone. I want to close myself off from the world. I just want to sleep in bed all day. And finally, acceptance. Okay? And here is what is so crazy about these 5 stages of grief that I just gave it to you in the classic order. First is you're going to be in denial. Then you're going to be angry. Then you're going to try to bargain. Then you're going to go through depression, and then you'll accept, right? So even though those are your 5 classic stages in that order, guess what? Sometimes patients can revert and move backwards. So they got to the acceptance stage, and then they go back to the bargaining. Please, God, give me this one chance, and I'll do this or I'll do that. Or they'll go back to the anger stage. I don't deserve for this to happen to me. This should have happened to someone else. So even though those are your 5 classic order that the stages should go into, sometimes, guys, the patients revert back. Sometimes they jump forward. Sometimes they skip steps and then go back to where they were. But if you're asked about the classic order, that is what the classic order is. Next question. Which situation requires priority intervention on an inpatient psychiatric unit? 1, the client is threatening to throw the television at another client. 2, a male client wants to use the phone to call his spouse. 3, a client sitting in a chair is delusional and hallucinating. Or 4, a client has refused to eat anything for the last 2 days. And the correct answer, guys, is 1. The client's threatening to throw the television at another client. Why? Patient safety. Yeah, that patient safety is an immediate danger. The other choice is that patient is not in as immediate danger as the one who's threatened to hurt other people. So let's look at our choices. You had choice 2, the male client who wants to use a phone. They're not in danger. You have choice 3, the client sitting in a chair. They're delusional and hallucinating. Well, we don't want them to be delusional or hallucinating, but there's no immediate danger at the moment. And then you have 4, the client who refused to eat anything for the past 2 days. Now, that's a problem. Yes, the patient hasn't eaten. We want them to eat. And guess what? Even if they haven't eaten in 2 days, we can't force them to eat without an order. So what we're going to do is we're going to get an injunction by the judge. If the patient needs a feeding tube, that's what we'll do. But without that legal document allowing us to do that, you can't force the patient. So who's in immediate danger? The one who's in danger right now of being hurt. And that's the patients who are around the patient who's threatening to throw, a television at another client. So number 1, no one else at the moment is in immediate harm. Next question. The client diagnosed with bipolar disorder and who's prescribed a lithium, an anti-mania medication, is admitted to the psych unit in an acute manic state. Which intervention should the nurse implement first? 1. Have the laboratory draw a stat serum lithium level. 2. Evaluate what behavior prompted the psychiatric admission. 3. Assess and treat the client's physiological needs. Or 4. Administer a stat dose of lithium to the client. So the correct answer, guys, 3. You're going to assess that client's physiological needs, because guess what? We don't care about anything else unless the patient's physiological needs are intact. Remember I told you, when it comes to test questions, most test questions are based on these 3 concepts: ADPI, Maslow's hierarchy of needs, and ABCs, right? And of course, with Maslow's hierarchy of needs, our foundation, the most important thing is what? Physiological needs. What is keeping that patient alive? Vital signs, fluid and electrolytes, glucose, nutrition, airway, oxygen, blood, right? All the good stuff that keeps that patient alive. So we really don't care about that lithium or anything else if the patient's dying, right? So we want to make sure that their physiological needs have been met first before we start worrying about checking their serum for lithium levels, which we do want to do if patients on lithium. But first things first, we need to make sure that their physiological integrity is intact. Next question. The psychiatric unit staff is upset about the new female charge nurse who just sits in her office all day. One of the staff members informs the clinical manager about the situation. Which statement by the clinical manager indicates a laissez-faire leadership style? 1. I will schedule a meeting to discuss the concerns with the charge nurse. 2. I hired the new charge nurse and she is doing exactly what I told her to do. 3. You and the staff should really take care of the situation on your own. Or 4. I will talk to the charge nurse about your concerns and get back to you. Now, I didn't mention this before, guys, but if you're new to my channel, if I'm going a little bit too fast, that's okay. Just press the pause button, read the question, read your choices. Whenever you're ready to resume, just press play and we'll keep it moving. So the correct answer, guys, is 3. You and the staff really should take care of the situation on your own. So having a laissez-faire attitude is having the attitude of you guys figure it out. I'm not really going to take any authority in the situation. I'm not going to really be a leader in the situation. Basically, everybody's driving their own train, okay? That's the laissez-faire attitude. Now, let's look at our other choices. So when you see that word laissez-faire, that's what it means, okay? Everyone's just kind of, on their own. You have a number 1. I will schedule a meeting to discuss the concerns of the charge nurse. Well, that's a democratic position when you're having open communication and it's really a group dynamic. That is democratic. Then you have choice 2. I hired a new charge nurse and she is doing what I told her to do. That's autocratic. That's more of taking an authoritarian approach to the situation. Then, of course, you have the right answer, which is 3. That's laissez-faire. You guys just figure that on your own, right? And then 4. I will talk to the charge nurse about your concerns and get back to you. She's not saying we're going to discuss this. She says, I'm going to do this and then I'm going to let you know. Okay. And that's really when that nurse is really just taking charge of the situation. All right. So laissez-faire, you guys figure it out. I'm just going to sit back and watch. Next question. The mental health worker reports that one of the nurses threatened to force feed the male client diagnosed with schizophrenia if the client did not eat the meal on the lunch tray. Which action should the charge nurse take first? 1. Tell the mental health worker that this intervention is part of the client's care plan. 2. Request the nurse to come to the office and discuss the mental health worker's allegation. 3. Ask the client what happened between him and the nurse during lunch. Or 4. Ask the mental health worker to write down the situation and submit to the head nurse. And I'll give you a moment to think of your answer. So guys, the correct answer is number 2. Request the nurse to come to the office and discuss the mental health worker's allegation. So I've talked about this before, guys. Whenever there's an issue, unless patient care is involved, that patient's being abused, okay? You suspect abuse, or you suspect that the nurse is drunk or under the influence of drugs on the job, which, you know, they might give the patient wrong medication, they might harm the patient. Unless patient care is involved, that you suspect that patient's being abused or something like that, you always go directly to the source. So when another employee comes and tells you that they overheard the nurse doing XYZ, what are you going to do? Go directly to the nurse. AdPi, you assess, ask questions, get information first. Okay? That is the first thing you do. The only time you skip going to the source and you go to the manager or you go up the chain of command is when patient care is involved, such as abuse. All right? So let's look at our other choices. 1, tell the mental health worker that this intervention is part of the client's care plan. Threatening the client, that's assault. That is not part of the care plan. So that can't be the correct answer. 3, ask the client what happened between him and the nurse during lunch. You don't even go to that client until you go to who? The source. You go directly to the nurse and you assess and you find out what happened. You get their point of view. And then from the nurse, if you feel like if you need to assess further, then you can go to the client, then you can do more of an investigation, but you're going to go to the nurse first. Then choice 4, ask the mental health worker to write down the situation to submit to the head nurse. You never pass the buck. Guys, whenever you get an answer choice and it involves you passing this off to somebody else, like it's not my problem, someone else, that's not the answer. Don't ever choose it. It's always going to be wrong. Okay? You're going to go directly to the source, which is the nurse. All right. The client diagnosed with paranoid schizophrenia is imminently aggressive and is dangerous to himself, the other clients, and the psychiatric staff members. The client is placed in a seclusion room. Which intervention should the psychiatric nurse implement? Select all that applies. Now, guys, excuse me. I'm sorry, guys. I've been really sick and I'm really trying to get over this. All right. So select all that applies. Don't forget, we treat select all that applies as what? True or false. So that's what we're going to do here. Patients in seclusion. 1, assess the client every 2 hours for side effects of medication. True. Especially you had to give them something to calm down. You had to give them sedative. You have to assess them at least every 2 hours, right? You want to know what else you have to do while that patient's in seclusion? You have to assess their need for nutrition. Are you hungry? Are you thirsty? And you have to document that you offered that patient food and water. You have to assess their need to use the restroom to relieve themselves. Right? And not only do you ask them, do you need to relieve yourself, and you take them to the restroom if they need to go to the restroom, you have to document that you offered them and how often you offered them and what the patient's response was, yes or no. Okay? So choice number 1, absolutely true. We're going to keep that. Choice number 2, tell the client what behavior will prompt the release from seclusion. Absolutely. You have to give that client a chance to correct the behavior. Okay? Just because, so for example, we put a patient in seclusion. By the way, guys, you put a patient in seclusion, you have that order, you have to have an order for it, and that order is good for 24 hours. After that, the physician has to come see the patient, just like with restraints. There is no difference. Okay? But just because the order has to be renewed in 24 hours, do you have to keep that patient in seclusion for 24 hours? No. You tell the patient why they're being secluded and what behaviors they have to demonstrate in order to come out of the seclusion. Because the goal is to get that behavior under control so they're not harming themselves or anyone else around them. Okay, so it's very important. Yes, you absolutely must let them know what behaviors they have to demonstrate in order to come out of the seclusion. Choice 3, do not notify the client's family of the initiation of seclusion. That is false. So we're not going to pick that as an answer, because guess what? A patient goes into seclusion. A patient has to get restraints. Family must be notified, and they must be notified promptly. So number 3, we're not going to keep. 4, explain that the client will be in the seclusion room for 24 hours. That's false. They don't have to be in the seclusion room for 24 hours. If they demonstrate the behavior that we told them we needed for them to get out of seclusion, we take them out of seclusion. So 4 is false. And then you have 5. Instruct the mental health worker to check the client every 10 to 15 minutes. True. You have to constantly be checking that client if you don't have a continuous video feed. Okay? Next question. The psychiatric nurse overhears a mental health worker arguing with the client diagnosed with paranoid schizophrenia. Which action should the nurse implement? 1, ask the mental health worker to go to the nurse's station. 2, tell the mental health worker to quit arguing with the client. 3, notify the clinical manager on the psychiatric unit. 4, report this behavior to the client abuse committee. And the correct answer is 1, ask the mental health worker to go to the nurse's station, okay? So you're not going to discuss any of this in front of patients. You're going to ask them to come to the nurse's station, and the first thing you're going to do is assess, ask questions, what is going on? And then later in the conversation, after the nurse has spoken, you're going to tell the nurse how, let me go back to the question. Okay, arguing. So then you're going to talk to the nurse and explain how it's inappropriate to go back and forth with patient. They should not be arguing because remember, especially in mental health, we don't want to go into what? Power struggles with patients, right? So we don't want to enter arguments with patients, but you do that away from the patient so they can't hear, because the last thing you want is splitting to happen. So you're going to have the nurse come to the nurse's station, assess the situation, and then have a necessary discussion. Next question. The psychiatric nurse has taken 15 minutes extra for the lunch break 2 times in the last week. Which action should the female clinical manager implement? 1, take no action and continue to watch the nurse's behavior. 2, document the behavior in writing and place in the nurse's file. 3, tell the nurse to check in and out when taking lunch. Or 4, talk to the nurse informally about taking 45 minutes for lunch. And the correct answer is 4. Again, guys, and I hope you're starting to see a theme here, right? What is the first thing you do? Assess. You talk. Assessment, guys, is not only looking at a patient. Assessment is anything that gathers information. So asking questions, having a discussion, looking in the patient's chart, right? All of that are forms of assessment. You're always going to assess first because assessment gives you the baseline of what you need to teach, what you need to discuss, what you need to correct, but you won't, what interventions you need to do, but you won't know any of those until you assess, you ask questions, you get information, okay? Next question. The client's diagnosed with Alzheimer's disease, and they're on a special unit for clients with cognitive disorders. Which assessment data would warrant immediate intervention by the psychiatric nurse? 1, the client does not know his or her name, date, or place. 2, the client's unable to dress himself or herself without assistance. 3, the client is difficult to arouse from sleep. Or 4, the client needs assistance when eating a meal. And the correct answer, guys, is 3, that they're difficult to arouse. That is not normal part of Alzheimer's. All the other choices are. So let's look at this. 1, not knowing their name, date, or place. 2, being unable to dress themselves. Because remember, Alzheimer's is progressive. That means as time goes on, it gets even worse. They'll get to the point where they don't even recognize buttons, what to do with them. So they can't dress themselves. And then 4, they're unable to eat by themselves. They need someone to help them eat a meal. All of those are manifestations we expect to see in Alzheimer's. But difficulty arousal, waking them up from sleep, that is not normal, okay? And so that's what is going to be a priority, and that's going to require further investigation. Next question. The mother of a client recently diagnosed with schizophrenia says to the nurse, "I was afraid of my son. Will he be all right?" Which response by the psychiatric nurse supports the ethical principle of veracity? 1. I can see your fear. You're concerned your son will not be all right. 2. If your son takes medication, the symptoms can be controlled. 3. Why were you afraid of your son? Did you think he would hurt you? 4. Schizophrenia is a mental illness and your son will not be all right. So guys, the correct answer is 2. If your son takes medications, the symptoms can be controlled. Patient's not going to be cured because there's no cure for schizophrenia, but you can control the symptoms with the right cocktail of meds and the patient being compliant with their medications. Okay? Veracity. What does veracity mean? To tell the truth. And so this choice, number 2, is the truth. Let's look at our other choices so you can know why our other choices are wrong. 1, I can see your fear. You're concerned that your son will not be all right. Guys, this is a beautiful therapeutic response, but it does not display veracity. The question is asking us which one is showing veracity, which one is showing that we're being truthful. And although number 1 is a beautiful answer, especially when it comes to psych, right? It's a beautiful therapeutic response. It doesn't answer our question. Our question is asking us about veracity, not which response is most therapeutic. So number 1 is wrong. Number 3, why? Stop right there. I can't even with you. Don't ever ask a patient why or what made you. Those are big no-nos. You never ask a patient, why did you do this? Why did you do that? The minute you do that, you're putting them on the defensive. You never say to a patient, what made you? The minute you say what made you, you took responsibility from that patient and gave them an open door to say, oh, the voices in my head made me do this, right? Or, oh, my roommate told me to do this, put a gun to my head. So you never say why and you never say what made you to a patient. So that's wrong. And then you have choice 4. Schizophrenia is a mental illness and your son will not be all right. Well, that's the opposite of veracity because that's not true. Yes, schizophrenia is a mental illness, but that doesn't mean your son will not be all right. That doesn't mean your son cannot live a productive life. Many people with schizophrenia are working professionals. They have families. They have careers. They have to take their medications and recognize when, if they're getting exacerbations of symptoms, to seek help, right? So the only one that's displaying veracity, showing truth, is choice number 2. All right, next question. The client in the psychiatric unit tells the nurse, someone just put a bomb under the couch in the lobby. What action should the nurse implement first? 1, look under the couch for a bomb. 2, implement the bomb scare protocol. 3, have the staff evacuate the unit. Or 4, tell the client there is no bomb. Guys, I think by now, you guys are seeing a common thread. What do we do first in ADPI? Assess. Look under the couch. I'm pretty sure there's not going to be a bomb, but you look first. How can you tell the patient there's no bomb and you didn't look? ADPI, assess, diagnosis, planning, intervention, evaluation. The first step is what? Assessment. Getting information. So you just look under the couch. All right. Number 59. Next question, because I'm not going in order. I'm sorry. The head nurse in a psychiatric unit in the county emergency department is assigning clients to the staff nurses. Which client should be assigned to the most experienced nurse? 1, the client who's crying and upset because she was raped. 2, the client diagnosed with bipolar disorder who's agitated. 3, the client who is found wandering in the streets in a daze. 4, the client diagnosed with schizophrenia who is hallucinating. And the correct answer is 3. So guys, when the question asks you, who are you going to give to the most experienced nurse? What they really mean is who is the most unstable. Who requires the most in-depth assessment? Who requires the most in-depth teaching? Because obviously that's the patient that you're going to give to the most experienced nurse, right? So I want you guys to look at this, guys. Number 1, we know what's wrong with them. They got raped. Number 2, we know what's wrong with them. They've got bipolar disorder. They're agitated. Number 4, we know what's wrong with them. They've got schizophrenia and they're hallucinating, okay? We're seeing manifestations of disease processes or situations that we know is happening. But with choice 3, this client was just found walking in a daze. That's all they told us. We know nothing else about this patient. So we're going to have to do really in-depth assessment on the patient to figure out what their needs are going to be, right? So you're going to give that to the most experienced nurse. The client diagnosed with anorexia is refusing to eat and is less than 20% of ideal body weight for her height and structure. The client has not eaten anything since admission 2 days ago. Which action should the nurse implement? This is so funny. I actually gave you this answer in another question. So your choices are 1, notify the psychiatrist to request a court order to feed the client. 2, take no action because the client has the right to refuse treatment. 3, discharge the client because she's not complying with the treatment. Or 4, physically restrain the client and insert an NG tube for feeding. And the correct answer is 1. Getting the doctor to get a court order to feed the patient. Because not only has this patient not eaten in 2 days, okay? Not only that, this patient is less than 20% of their ideal body weight, okay? And we go ahead and force feed that patient without an order. We just committed battery. So we can't do that. We have to get an order. So the correct answer is 1. Let's look at our other choices. Number 2, take no action because they have a right to refuse treatment. That's neglect. So this patient is less than 20% of their ideal body weight. They haven't eaten in 2 days. They've refused to eat and you're just going to do nothing about it and watch them die. Yeah, you're going to lose your license. Choice 3, discharge them because they're not complying. So you're sending them home to die. This patient is not stable. How are you going to send them home? That's malpractice. You're going to lose your license. And then you have choice 4. Oh, we're physically restraining patients now. Oh, you're definitely losing your license and you're going to jail. Okay? So the only thing you can do is 1, get that court order to feed the patient. Next question. The nurse answers the client's phone in the lobby area and the person asks, may I speak to Mr. Jones? Which action should the nurse implement? 1, ask the caller who's asking for Mr. Jones. 2, tell the caller Mr. Jones cannot have phone calls. 3, request the caller to give the access code for information. 4, find Mr. Jones and tell him he has a phone call. The correct answer is 4, and here's why. Let's go back to the question. It says that the client's phone in the lobby. So it's not like somebody called the nurse's station, the facility, asking to speak to the patient, where obviously if it's a psych unit and they ask the patient's name and we say, oh yes, the patient's here, we basically just told whoever was on the other line that that this patient is in that facility, right? You're violating HIPAA. But no, whoever was on that line called the patient's phone. Why we're picking up the patient's phone, I don't know, but let's roll with it, right? It's the patient's phone that they called, not, the facility phone in the lobby. So let's go through our choices. You have 1, ask the caller who's asking Mr. Jones. That's none of your business. That's the patient's phone that you picked up. Why you picked up their phone, I don't know, but that's neither here nor there, so that's wrong. You have 2, tell the caller Mr. Jones can't have phone calls. Just because you're in a psych unit doesn't mean you're a prisoner, okay? Of course you can have phone calls unless specifically in the question they tell you for whatever reason the patient cannot have phone calls, but they're not prisoners. Yes, they can have phone calls. 3, what's choice 3? Request a caller to give the access code for information. Again, they're calling the patient's cell phone, not a facility. And so the correct answer is 4. You're just going to let Mr. Jones know that he has a phone call. The client, seeing the psychiatric nurse in the mental health clinic, tells the nurse, "If I tell you something very important, will you promise not to tell anyone?" Which statement is the nurse's best response? 1, I promise I will not tell anyone if you don't want me to. 2, if it affects your care, I will have to tell someone who can help. 3, if you don't want me to tell anyone, then please don't tell me. 4, why do you not want me to tell anyone if it's so important? So guys, the correct answer is 2. You have to be honest with the patient and tell them from the jump. Before they tell you what it is, you tell them. If it's something that will affect your care, I have to tell the rest of the team. I cannot keep it a secret. And you have to be honest with the patient. You tell them that, okay? You have to do that. Let's look at our other choices. 1, I promise, stop. You don't make promises to patients. You don't make promises to keep secrets. You don't do that, okay? So stop right there. We throw that out. Number 3, if you don't want me to tell anyone, then please don't tell me. You never just shut a patient down when they want to communicate, okay? You want them to communicate. You just have to warn them. Whatever they're communicating, if it's anything that will affect them, you have to let the rest of the staff know, but you don't shut them down and tell them, oh, I don't want to hear this. Keep it to yourself. And then choice 4, why? Stop. We never, ever, ever ask a patient why or what made you. So the only answer it could be is 2. If it affects your care, I will have to tell someone who can help. Okay, guys, we are down to our last question, but I promise I'm going to make this a part 2 because it's actually supposed to be more questions, but I don't know why my camera keeps kind of slanting. And I tried ignoring it, but it's not working, so I got to fix the problem. But I promise I'm going to be coming back with a part 2 once I fix this issue, okay? So this last question. Which situation would warrant immediate intervention by the charge nurse on the psych unit after receiving the morning shift report? 1, the client diagnosed with paranoid schizophrenia who's delusional. Oh, this is driving me crazy. 2, the PM shift licensed practical nurse called in to say she'd not be into work today. 3, the male mental health worker reports losing his unit key and identification card. Or 4, the unit secretary has doctor's orders that needs to be co-signed. And the correct answer is 3. The mental health worker that lost their unit key and identification badge, guess what? This unit is no longer secure. And every single patient on that unit is what? At risk. Patient safety is involved. So that's going to be your priority, finding those keys in that badge, because until you do, that whole unit is insecure and all of your patient safety is at risk. Guys, I hope this video was helpful to you. I promise a part 2 is coming. Please, guys, if you want to support this channel, share my videos. Anyone you know that's a nursing student, just a new grad, share my videos. Please, please, please. Don't forget, like, comment, and subscribe. Send me a comment if there's anything you'd like to see me cover that I have not covered yet. I promise I'm making a list, and I'm trying to get through them as many videos as I can. Excuse me. But it takes a little time. And the reason for that, guys, is I'm very thorough. Like, you see these questions I'm covering with you? These are the questions that you're most likely to get on your midterm, on your final, on, NCLEX, HESI, ATI. So I don't just pick random questions. I really go through them and try to find the concepts that are very important for you to know. But if there's something I haven't covered yet that you'd like to see, please just let me know in the comments and I will add it to my list. Thank you so much for supporting me. Thank you for watching, and I'll see you next time.